are starting the new year setting new records when it comes to COVID-19. Tonight, the state reporting a percent positive rate of 16.5, 3 times what it should be to reopen the economy.
And more than 3,600 people are in the hospital with COVID-19 tonight. It's the third day in a row we've set new records for the number of people in the hospital.
And right now, some hospitals across our state are reaching capacity, which impacts not only COVID patients, but others with all types of medical conditions.
So what if some hospital patients didn't actually have to stay in the hospital? What if they could get the same level of care at home? It's something UNC says we'll see here in the Triangle later this year. CBS 17's Maggie Newland getting answers about how this will all work.
Marius, throughout the pandemic, some doctors have offered virtual visits, diagnosing and treating illnesses over the phone or on your computer. Well, UNC plans to take this a step further, offering hospital-level care for some patients right in their own homes.
Patients who go to the hospital usually stay until they're well enough to go home on their own. But later this year, UNC Health system will offer qualifying patients the chance to go home with their healthcare team.
Their care is managed the exact same way it would be managed in the hospital by a 24/7 command center of nurses and providers that are there constantly, watching after that patient.
I have a hospital in my house.
This video from the Mayo Clinic shows how it works. Healthcare workers go to the patient's home to perform procedures and treatments. The patient has an iPad to interact with doctors and nurses and devices that monitor vital signs or symptoms.
Does this take time away from doctors to focus on their patients in the hospital, though?
It allows patients and the providers to be able to see patients more efficiently. We have been looking at this effectively as another hospital, right? It's another care setting that we would have a separate, clinical team there.
Matt Smith, who's working to put the program in place at UNC, says that team will focus solely on patients at home. And UNC plans to hire additional staff.
Through COVID, as our providers have gotten used to the virtual environment, there's been a lot of interest.
This approach won't work for everyone, but it could help people with chronic illness, infections, those who've recently had surgery, and some COVID patients. A patient's condition would need to be stable.
In a hospital, if someone goes into cardiac arrest, immediately you have a team of people there to help. This wouldn't be the same situation.
But our feeling is we're having regular routine engagement with the patient, and we have a good sense of where they are. But if they need to call emergency services, those would be called.
He says teams monitoring patients virtually can also notice problems and arrange treatment before they lead to an emergency.
Now, UNC hopes to have this program in place by May or June of this year. Right now, it's only offered in a handful of hospitals. We do hope to have it here at both UNC Chapel Hill and Rex and then expand throughout the state. But because it is offered in so few places, UNC is still working with insurance companies to figure out the costs. We're live. Maggie Newland, CBS 17 News.
Very interesting. Maggie, thank you.